This has been a great discussion and really informative. And before we end, I'd like to get the final thoughts from each of our panelists. Francisco, do you have any final thoughts?
Well, I think this has been very useful to review the San Antonio Symposium, looking at the different molecular subtypes of breast cancer in the ER-positive population, CDK4/6 inhibitors, major advance in breast cancer, HER2 therapies, not major changes. We talked about adjuvant therapies with neratinib and pertuzumab playing a major role, and in triple negative, some excitements with antibody-drug conjugates and immunotherapy. So I found the discussion very stimulating. Thank you.
Komal?
Yeah, I think this was an exciting year for various reasons, including newer drugs coming. We have our first PARP inhibitor approved for the very first time for our BRCA mutant patients. This is exciting, finally. We have exciting new drugs, including the antibody-drug conjugates that we definitely discussed that are very, very novel and very efficacious, looks like, at least in the phase 2 trials. And what was also nice is to see a confirmation of either our biases or our skepticisms in the early stage setting and data specifically focused on subgroups that we would really like, including the premenopausal patients where we now have the CDK4/6 inhibitor data. So I think it was nice to see a confirmation of our biases in certain areas, including ovarian function suppression and so on and so forth, and having new drugs to offer our patients.
Great. Hope?
Yeah, I mean, of course, I'm just going to mirror what you guys said. I think it's great to have a discussion and hear what people think about these new studies and new agents, as well as the things we've already known about and are seeing longer follow-up. But to me, I think the two most exciting things, HER2-positive disease is great and we're learning more. But ER-positive disease, it represents the majority of breast cancer early and late stage. The CDK4/6 inhibitor is just totally exciting. And the data on ovarian suppression, finally, after so many years. And, the whole goal is that to cure women, I sort of feel like ER-positive disease is like locusts. It's going to survive the nuclear holocaust. I mean, we get these people still relapsing, stage 1 disease, 15 years. Why are they relapsing? Maybe what we're learning now is going to help us prevent those late relapses. And the immunotherapy thing, I mean, I worked in the lab 30 years ago on the
as we all did.
Immune system, cytokines. We were looking at, cytokines and all this. So now I just feel like it's made a whole 360 turn around, and now we are finding a place for immunotherapy in breast cancer, and it's really exciting. So I'm excited to see the next few years of data.
Lee?
Well, it's hard to be last, and after my colleagues, right. So the only thing I will say is that as a breast medical oncologist, I look forward to San Antonio as my favorite meeting of the year because it invigorates us. We hear the best data. We hear wonderful summaries of where the field is now. And I think the science in breast cancer is really making tangible differences in our patients' lives now, and that's exciting.
I would agree. That's a great way to summarize it. Thank you. So thank you all for your contributions to this discussion. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative. Thank you again.